Without any further ado, I'm going to introduce the Minister of Health, Dr. Nomafrench Mbombo, who is an academic, an activist, and a politician. I hope in that order. I've worked now for one term of office with Minister Mbombo, and she's never disappointed me in her caring for the community. So in previous times I used to introduce her and say, I think she's a good person. Now I can say, I'd like you to welcome a genuinely good person, Minister Mbombo.
Just to acknowledge the team, for the palliative team, who have been trying by all means in terms of the implementation of the policy, but prior to that, because some of you might not know that palliative care has always been the stepchild of the health system, of the health care. We have got the preventive, promotive, curative, rehabilitative, and then it comes to the palliative care, and then it gets quiet. So the people who have shown so much passion about palliative care. The first we were talking more, I think we started at the, which hall? It was Tukai.
One thing.
Yes. And also we at the time we spent it also with the clients and patients themselves, the NGOs. And then we went to the Lente here. Again, we're doing a lot of talking, but here, no more talking. I think the most important thing is about today, we are not doing the talking. We are opening it. Today, ideally, actually, we're supposed to be saying, Dr. GP, we are supposed to be saying that it's not only the Victoria Hospital, at least we're supposed to have covered throughout some of integration of the palliative care into the system, which is the district health system. We want to acknowledge the Hospice, the Red Cross, and the others, also the Victoria, who have done a lot when it comes to bringing the palliative care into the system. Now, going forward, we're going towards the NHI/UHC. We do know when it comes to the universal health coverage, palliative care forms part of that, but we always forget about it. So with the rents and cents, I think now your responsibility, Doc and the team, is about to cost it so that it could be able to be utilized for service providers in future who will be providing the palliative care. We do know that the NGOs, the hospices and all of those, they've been doing it for many, many years. But now, because everyone will have an appetite when it is being opened up to be service provider towards the NHI, as we know that in terms of the human rights issue, no one can be denied a pain, a killer, and so forth, also in terms of the caring whilst the person is alive. And also affordability must never become the issue, irrespective whether you are a pregnant mom or you are a palliative care patient.